Greetings and welcome to the Victory Education Lounge. Today, we're taking a deep dive into a pivotal topic for those on the path to a medical residency. The question we're tackling is, can you discuss a research project you were involved in? So, if you're ready to embark on this exciting phase of your medical career, don't forget to hit the like button, subscribe for more content, and share your thoughts or questions in the comments below. Let's dive into the world of the medical residency interview process and move one step closer to your residency goals. It might seem straightforward, but your answer can speak volumes about your skills, experience, and commitment to medicine. It's not just about the facts of your research, but how you articulate your role, the challenges you faced, the outcomes, and how it all ties into your medical journey. By the end of this video, you'll have a better understanding of how to frame your answer effectively and feel more confident when this question comes up in your interviews. So buckle up and get ready to boost your interview skills. Stay tuned as we delve into effective ways of answering this question. Before crafting an answer, comprehend why interviewers ask this question. When faced with the inquiry, "Can you discuss a research project you were involved in?" It may seem like it's all about the project itself, but it goes deeper than that. It's a chance for the interviewers to peek into your analytical abilities, your dedication towards the medical field, and your competence in conducting scientific research. Your ability to grasp complex concepts, to stick with a project through its highs and lows, and to contribute to the scientific community are all under the microscope during this discussion. The question is also a measure of your storytelling skills. Can you take a complex scientific project and break it down into understandable, interesting pieces? Can you make the interviewer care about your research as much as you do? This is your opportunity to demonstrate that you can communicate complex ideas clearly and concisely, a skill that's critical in the medical field. In addition, the interviewers are keen on understanding your role in the research. Were you a follower or a leader? Did you contribute significantly to the project, or did you merely follow instructions? This question gives you the chance to showcase your strengths, be it in leadership, teamwork, problem-solving, or critical thinking. Moreover, they're interested in the impact of the research. Did it contribute to the field of medicine? How did it shape your path in the medical journey? This aspect of the question allows you to demonstrate your understanding of the bigger picture and how research can contribute to advancements in healthcare. Lastly, they want to know how you dealt with challenges during the course of the project. Every research project encounters roadblocks, and your approach towards these obstacles provides insight into your problem-solving skills and resilience. Keep these points in mind as you prepare your response. Understanding the layers of this question helps you frame an answer that not only highlights your research experience, but also reveals your analytical prowess, commitment to medicine, and your ability to navigate challenges. Now, what should your answer entail? Here are some key elements. To craft a compelling answer, it's crucial to include 5 elements: the research overview, your role and contributions, the challenges and solutions, the outcomes, and the impact on your medical career. Beginning with the research overview, it's essential to give a concise summary of your project. What was the focus of the research? What was the goal? This sets the context for the rest of your answer. Secondly, your role and contributions. Be specific about your tasks and responsibilities. Did you collect data, analyze results, or perhaps lead the team? Your interviewer wants to understand your level of involvement and the skills you applied or developed. Thirdly, discuss any challenges you faced during the research process and how you overcame them. This shows resilience, problem-solving skills, and the ability to adapt, all of which are critical in the medical field. Next, share the outcomes or findings of the research. This could include published papers, changes in protocols, or new insights into a medical condition. Remember, the goal here isn't to impress with groundbreaking results, but to demonstrate your understanding of the scientific process and your ability to learn from it. Finally, reflect on how this experience influenced your medical journey. Did it shape your interests, reinforce your commitment to medicine, or perhaps inspire you to pursue a certain specialty? This ties your research back to your personal story and future aspirations in medicine. Incorporating these elements will ensure a comprehensive and engaging response. Each component adds depth to your answer, painting a complete picture of your research experience, your skills, and your dedication to medicine. Remember, the aim is not just to talk about your research, but to connect it to your broader medical journey and show how it makes you a strong candidate for residency. So take the time to reflect on these elements, and you'll be well on your way to crafting a compelling answer. Now let's move on to some sample answers to help you understand how to integrate these elements effectively. Let's explore the first way to answer this question with a clinical research project. Imagine you're in the hot seat, and the interviewer asks, "Can you discuss a research project you were involved in?" You could respond like this. During my final year of medical school, I had the opportunity to participate in a clinical research project. We were studying potential treatment options for patients suffering from hypertension. It was a large-scale project involving hundreds of patients, and my role was a crucial one. I was responsible for patient recruitment and subsequent data analysis. Recruiting patients for the study was a challenging task. It required a delicate balance of explaining the project's potential benefits and respecting the patient's autonomy. However, overcoming this hurdle taught me invaluable lessons about patient communication and consent. Once the data started coming in, my role shifted to analysis. I worked closely with a team of researchers, sifting through the data, looking for patterns and drawing conclusions. This involved long hours and meticulous attention to detail, but the experience honed my analytical skills and deepened my understanding of the disease process in hypertension. The outcomes of our research were promising. We found that a combination of two drugs was more effective in controlling blood pressure than the standard treatment. This finding has the potential to change how we treat hypertension and improve patient outcomes significantly. This research project was a turning point in my medical journey. It allowed me to see the direct impact of research on patient care. It also reinforced my commitment to cardiology, a field where I believe I can make a significant difference. Notice how this response not only describes the research but also its influence on the candidate's medical journey. It touches upon all the key elements we discussed earlier, providing a clear, comprehensive, and engaging answer to the question, "Can you discuss a research project you were involved in?" Moving on to the second approach, let's consider a lab-based project. Picture this. You're in your undergraduate years, really sinking your teeth into the world of scientific research for the first time. You're fortunate enough to land a position on a genetics project exploring gene mutations in rare diseases. It's a fascinating field, one that's constantly evolving and offering new insights into how our bodies work. Your role in this project is primarily in data collection and analysis. You're dealing with complex genetic codes, meticulously documenting any variations you find. Your days are filled with lab work, poring over data, and brainstorming with your team. The work is challenging, but it's also incredibly rewarding. You're contributing to the understanding of rare genetic disorders, and that's no small feat. There are challenges, of course. The genetic data is complex, and there's a steep learning curve in understanding how to interpret it. But you rise to the occasion, spending long nights studying genetics textbooks and consulting with your mentors. You develop a keen eye for detail and a deep understanding of genetic data analysis. When the project concludes, you and your team have a wealth of new data on gene mutations in rare diseases. This research could potentially contribute to new treatments or better diagnostic techniques. It's a thrilling thought, and it's one of the reasons you're so drawn to the medical field. But the project does more than just contribute to your analytical skills. It sparks a deep interest in genetic disorders. You find yourself fascinated by the complexity of the human genome and the myriad ways it can influence health. This experience stays with you, influencing your decision to pursue a residency in medical genetics. This answer showcases the candidate's analytical skills and the project's influence on their medical interests. It paints a picture of a dedicated, curious, and meticulous individual, exactly the kind of person who would thrive in a medical residency. And it does all this while answering the interviewer's question in a clear and engaging manner. The third approach involves highlighting a public health research project. Picture this. During your postgraduate studies, you took the initiative to lead a research project in the public health arena. The study focused on examining the effects of rapid urbanization on the mental health of residents in a fast-growing city. Your role was multifaceted. Not only did you design the research methodology and lead the data collection efforts, but you also coordinated a team of fellow researchers. You faced challenges along the way, particularly in collecting data from a diverse population and ensuring the treatment of sensitive mental health information with utmost respect and confidentiality. Despite these hurdles, you persevered. You developed innovative solutions, such as implementing a randomized sampling strategy to ensure diverse representation and establishing strict protocols for data privacy. Your leadership skills were put to the test and you emerged more resilient and competent. The findings from your research were eye-opening. The study revealed a significant correlation between rapid urbanization and increased mental health issues. thereby highlighting the urgent need for mental health infrastructure in urban planning. This revelation not only contributed to the current body of public health knowledge, but also influenced local policy recommendations. Reflecting on this experience, you explain how it shaped your medical career. It not only enhanced your leadership skills, but also broadened your perspective on healthcare. You realize that healthcare is not confined to the four walls of a hospital or a clinic. It's intertwined with social factors like urbanization, and as a future physician, you have a role to play in this larger narrative. Such an answer demonstrates the candidate's leadership abilities and their broad perspective on healthcare. It shows that you can navigate complex challenges, lead a team, and contribute to meaningful research that can influence public health policies. More importantly, it shows that you understand the larger societal context of healthcare, a perspective that's invaluable in the medical field. As we approach the end, remember that authenticity and clarity are key. It's essential to always connect your research experience to your medical journey, demonstrating your growth and understanding. Let's recap the main points we've discussed. When answering the question, "Can you discuss a research project you were involved in?" ensure to include a brief overview of the research, your specific role and contributions, the challenges faced and how you overcame them, the outcomes or findings, and most importantly, how this experience influenced your path in medicine. We've explored 5 different approaches to answer this question, each showcasing a different type of research project. Whether it was a clinical research project, lab-based research, public health research, a case study, or translational research, each approach highlighted different skills and learnings. Remember, there's no one-size-fits-all answer. Your experiences are unique, and so should be your responses. The key is to tailor your answer to reflect your genuine experiences and learnings. Demonstrate how your research experience has shaped your understanding of medicine, honed your skills, and driven your passion. Use this question as an opportunity to show your analytical abilities, your commitment to the medical field, and your aptitude for scientific inquiry. But, most importantly, let your enthusiasm and passion shine through your answer. Consider practicing your response, but ensure it doesn't sound rehearsed. You want to come across as confident and knowledgeable without sounding robotic. And finally, remember that an interview is not just about answering questions. It's also about showcasing your personality, your drive, and your commitment to your chosen field. As you embark on this exciting journey, remember that preparation is key. Take your time, be thorough, and most importantly, believe in yourself. You've come this far, and a rewarding career in medicine awaits you. Now that you're ready to embark on this exciting phase of your medical career, don't forget to hit the like button, subscribe for more content, and share your thoughts or questions in the comments below. Let's dive into the world of medical residency interview process and move one step closer to your residency goals. Thank you for joining us at the Victory Education Lounge. Keep striving for victory in your medical journey.